So thank you very much, Artavas, for that presentation. Thank you very much, Samuel, for inviting us. It's an honor to be here. And I just want to briefly complement the Artavas's presentation on food safety, putting it under the context of One Health, because right now the World Bank is leading the work on food systems transformation, considering that our food systems are no longer fit for purpose. And food safety is one of the many aspects that are interwoven in this work, together with, for example, animal health and welfare, that, as we know, has a critical impact on food safety and food systems, AMR, and many other aspects. And just like Artavas mentioned, the purpose of this food systems transformation is healthier people, healthier planet, and healthier economies. So as we saw with Artavas's presentation, food safety has a massive impact on health of the planet, of the economies, and of people. They also, food safety also, for example, has a big impact on food loss and waste. And the safety of food is closely intertwined with the safety and health of animals. So food safety right now is part of the work that is carried out as under One Health and as the food systems transformation. So what I want to present today is how the bank is operationalizing One Health as part of this new agenda. So as a first point, I would like to present what are the key principles for investing in One Health for the bank. And these key principles, the first one is that the starting points, and I'll show a slide a bit later, the starting points for One Health will always vary by context, disease, and objectives. So countries need not only very strong human, animal, and environmental health management systems and coordination, but we also need to conduct mapping activities at the starting point, at the onset, to understand what is the situation in each country and each region if we want to take a regional approach. One Health is integral to the success of multi-sectoral national action plans for health security. It is with this integrated view that we'll address health security to reduce disaster risk and optimize pandemic preparedness and prevention and planning. One Health approaches should be built into the project design from the onset, so that we manage to frame and design projects with the integrative multidisciplinary One Health approach. We manage to engage all the relevant stakeholders from the early stage, promote common understandings and joint solutions, and anticipate the risks that stem from the gaps and the duplication, so we can facilitate coordination and communication. That is an important, this is also goes in tandem with the mapping I was just mentioning. And it's very important to have the landscape very clear when we take on any project on One Health. And then communication, of course, is a key priority for One Health and for understanding One Health and its implementation. With clear communication at all levels for all stakeholders, starting from consumers, we can plan for disease event and maintain strong multi-sectoral coordination channels. We can ensure effective messaging. For example, in one project that I'm going to mention a bit later, under the global platform for avian influenza that was led by the bank, this project was implemented in Egypt, and there were one of the many success factors of the projects was a very strong and clear campaign of communication that involved artists, singers, musicians, religious leaders, politicians, NGOs, everybody together to conduct this very thorough campaign that targeted consumers on, in this case, how to handle poultry to prevent avian influenza. It is with these kind of communication strategies that we manage risk, but we do it in an efficient way, and also we increase the credibility and the trust of those that are involved when it comes to consumers. Some cross-cutting drivers of One Health is we need to foment a solid connection between the operationalization of One Health and the global health security agenda, because we need to shift from country responses to global public goods. We need to foster partnerships that in turn will facilitate sharing responsibilities and resources. We need to implement the health in all policies. All the development policies, projects, and activities have to be reviewed for their health impacts. We're not only shifting from national to regional and global, we're also shifting from response to prevention. So in terms of food safety, this means that instead of controlling, for example, at the sales point, we need to go upstream and work with producers in the farm, in the fisheries, where animals are also produced, and work One Health with them and consider One Health food safety as part of the food production continuum, not as isolated points along the value chain. And again, the engagement and community level is key. It's critical for the functioning of food safety under a One Health approach. The stages of operationalizing One Health is, again, starting with a diagnosis and mapping. We can learn from past experience. We can use learning products, and we can use tools from external partners. We have the PBS, we have JEE, we have many relevant tools. We need to create an enabling environment where we define the scope and the entry points for work, allow for coordination, put all the stakeholders together, get them to communicate and collaborate across disciplines, and enable, of course, multi-sector strategies. The implementation, that if we did the previous steps right, implementations should be smooth and effective. And of course, we need monitoring, evaluation, and the bank has developed tools for this that I can leave with the resources of this presentation. Just as one relevant point, for One Health, entry points matter, the context matter. In the left, we see the traditional Venn diagram that depicts One Health, in which we see animal health, human health, and environmental health systems working together to implement a One Health approach. In the right, we see an example of how this Venn diagram adapts to different country scenarios, country and regional scenarios, because there is no just one solution that fits all. The role of each sector is going to vary tremendously per disease and per regional or country context. Here we have the Venn diagram adapted for Nipah virus. This is a case in Bangladesh, and since flying fox bats, where the reservoir for Nipah virus in this particular case, the role of the environment and animal health is much bigger than the role of human health as a driver and an entry point for One Health. In some cases, some of these bubbles will be, or circles will be smaller. In some cases, they will be bigger. There was another case of Nipah virus in which there was the transmission was different, and of course then we could see that each circle was different in the Venn diagram. And finally, just a couple of, and sorry, this slide I realize looks very heavy, a couple of examples of what actually makes a project a One Health project. We have the regional and global public good approach. For example, we have the Redice project in West Africa, now going to Central Africa, and it's phase 4. And instead of it's an interdependent series of projects in which the success of the whole project relies on the success of each one of these countries, and it banks on the individual successes to foster collective gains. There are regional projects. We have the Africa Center for Disease Control that builds common resources centers and shares information and resources. We have projects that strengthen multi-sectoral coordination and communication. For example, the global program on avian influenza that I mentioned before creates One Health platforms, and actually in Egypt, this One Health platform survives, is still in place today. Again, the Egypt COVID-19 emergency response is also enabling communication and coordination platforms under a One Health approach. We have a shift to prevention and preparedness from the traditional response to prevention and preparedness for risk management through investment in surveillance, laboratory capacity, and human resources development, just capacity building, again, like Artavas was mentioning. We recognize the close links among animal, human, and environmental health. An example in Brazil, the POI Productive and Social Inclusion Project expanded between public health, education, animal health to address tropical neglected diseases. So they took the close link between environment and health, but also targeted other drivers that were very important, such as education. And finally, we have multi-sectorality, which is basically the nature of One Health. Again, here we have an example in Bangladesh, the Metro Dhaka Transformation Platform. It's led by the Urban Global Practice in the Bank, with a collaboration from human health, agriculture. So it's basically a very, very good example of what One Health can do. I'm sorry that not all my examples are based in Middle East and North Africa region, but I'm happy to produce more if necessary. And that's my presentation. Thank you very much for your attention.